fried food, deli meat, alcohol, drugs, psychiatric drugs, and also you have to be very careful about the fish. You only want to have salmon, wild salmon. The rest of fish, and especially when the fish is too big, it probably has a lot of mercury because of the contamination we have in our water. If there is anything you take out of this talk today, is about loving relationships. The brain, from the first month in the womb of the mother, start maturing and pruning, and the first place is in our processing, auditory processing, at the first month after conception. And it continues recording everything that you say, everything that mother feels. And when we're born, if we don't have a kind mom or a replacement for it, the brain, especially the cells of bonding and loving brain, believe me, we have cells that form only with bonding with our moms. And if we don't have that connection, the brain stops maturing and pruning, goes to the position of emotional brain, reptile, fight, flight, and these people are always in trouble, both emotionally and with their body. Sleep, you know it's important for us, 7 hours for sure, and we have a special liquid melatonin, which is amazing. You put a few drops under your tongue if you can't sleep, but the lack of sleep causes a chaos in the brain, affects learning and memory. And in teen years, unfortunately, the brain doesn't still produce enough melatonin till age 18, 19. That's why we sleep better than our teenagers. And the teenagers have really a very off time and a difficult time to go to sleep. And that sleep deprivation is causing a lot of trauma in the brain. How much time I have? Not much? Can you go? Let's go fast. I'm going to skip sleep, and I'm going to skip neuroinflammation. I want you to know that when there is inflammation in the body, it begins with the brain, with the wrong eating, and with all the air pollution and wrong scents, and even autoimmune disease such as Lyme disease. Neurotoxins, I think our speakers mentioned it, they're everywhere, and it's in food, air, and water, and we really need to know what we're doing. Neurotoxins are causing a lot of our mental illnesses, and they are totally affecting our children. And one of the things that we know is by eating properly and drinking the right kind of alkaline water, which we will discuss. I mean, there will be a presentation for. The brain will get foggy, and the brain will have learning issues, and we cannot function well. Environment toxins are everywhere. We have over 1,000 environmental toxins. We've got over 2,800 cleaning and toxic products that we're buying in this country. Our kids are exposed, we are exposed, and we're asking when you go to your dentist, make sure that the dental fillings are without mercury, and so much more. Mercury, lead, poisonous additives that we have, the sprays we use cleaning, pesticides, herbicides are terrible. Electromagnetic fields everywhere, and unfortunately we are exposed too much to it, and we need to, we have many outlets. We have the alpha steam that we use in the office, And we've got so many ways to clear ourselves from getting these radiations. All I know is Dr. Black at Cedars-Sinai, every time he's got surgery for brain tumor, it's on the side that our kids or adults are using their cell phone. Electromagnetic field is actually killing our brain cells, and it's affecting the kids that now were born to this EMF world of technology, and now they're 18, and we see a lot of ADD, ADHD, a lot of dysfunction. The kids are lazy, the kids are not motivated, the kids are a zombie, foggy, they can't do anything. And we think about that. Trauma, neglect, emotional, psychological, sexual, physical, sits in the brain, doesn't go anywhere until we work and we assess the brain. Female and male work differently through trauma. Men get angry and they get aggressive, and women they are introjected and they keep it inside. It should be the other way around. It's changing. And I'm not going to go into how we help patients with trauma. I want to tell you that the kids are on weed and the teenagers are on weed. Everyone thinks that drugs and psychotropic drugs are the answer, and alcohol obviously is a depressant. Everything from this list affects the brain, and when we do the brain mapping, even with one take of psychotropic drugs, medications, or alcohol or drugs, we see a change in the brain waves. So what you take to the brain matters. Let's go to the next one, because these are huge topics. Now, I just want to tell you what we do to make a difference. Next one, please. Brain mapping. So it's a very easy process that we put a cap on you, and in 19 areas of the brain, we check the electrical activity of the brain. When you do a CT scan or MRI, it checks your physical damages and imbalances. And what we do is 90% more effective and efficient. I recommend everyone to do a brain map, and we remember Dr. Bob Marshall. He was one of the gurus of functional medicine. Loved brain map. Next one. This is the raw data that our neurologists send us back, and it actually pinpoints in all the different areas and brain activities what is going on and how alert or how sleepy the brain is in different areas. And then we analyze this with the next one, and this is a map of the brain. We can measure the amount of anxiety, depression, the amount of memory issues from short-term to long-term. We can tell if the person is at risk of getting dementia or Alzheimer, and we can reverse it. And we can check people with ADD, inattention, motivation, problems with the frontal lobe. It shows us exactly where the patient is emotionally and with traumatic brain injuries that that person has had. We have the state-of-the-art database with our neurologists, so the translation of the mapping in our in Mind Therapy Center is quite unique, and I put together a lot of information here. Next one, please. You have this copy because this shows what is the responsibility of each brain lobes, and I thought it was interesting for you. We use light, sound. These are all specially designed state-of-the-art, and motion. And this motion is just like the baby in the womb. We need that motion from left to right, right to left, to bring us to that state of releasing all the stress, all the trauma, all the imbalances in any form and shape. So this is actually an add-on therapy, and then we do EEG and HEG neurofeedback. I'm not going to explain to you what that is. You should come to Mind Therapy Center. But all I can tell you is that based on the data that our neurologists give us, now we have a plan of action, and we can actually know exactly in which area and what frequency and bandwidth we can work with the brain, non-invasive, easy, and you have to watch a video or a movie and laugh, because only with laughter you have a good time and the brain cells connect. Brain cells are like us, like people, and if you bring happy information, they actually get excited, and if you bring sad information, they actually die and get damaged. That picture was the picture of our neuro motion, light, sound that we put together, and this is the middle one is the session of neurofeedback. Next. And the last thing I have to tell you is that I'm not successful if I don't check the neurotransmitters. Neurotransmitters are the messengers between two cells. They take the information and they basically allow us to communicate and to understand.